primary agenda of the Prime Minister to call this review meeting, which was the scare of the fourth wave of COVID-19. Prime Minister Narendra Modi interacted with the chief ministers of all the states of the country. The Prime Minister chaired the meeting to assess the COVID situation in the country and the preparedness of the healthcare system and the status of the vaccination program as well. Now, as the country witnesses an uptick in the COVID cases, Delhi, Punjab, Haryana, Uttar Pradesh, Karnataka have already reimposed the mask mandate. They have appealed to the citizens to maintain social distancing at public places as well. Yash Raju on the broadcast with me. And Yash, what's the situation on the ground in your state with regards to the masking mandates and the social distancing protocols that have been rolled back in several of the states of our country?
Well, definitely, as you're clearly mentioning, we have been seeing that the COVID cases have been increasing in the past few days in this state, where now, yesterday, 72 cases have been reported in Tamil Nadu alone. Apart from that, there's also clear message given by Tamil Nadu government to ensure that the public mask has been also wear at multiple areas across Tamil Nadu. And apart from that, Tamil Nadu's Health Secretary Radhakrishnan has clearly mentioned that rupees 500 will be fine allocated for the persons who have been violating the mask protocol, which is given by the Tamil Nadu government. So now, Tamil Nadu government is taking multiple steps to ensure that all the safety protocols have been done and followed by the people of Tamil Nadu.
Okay. All right. Thank you, Yash, for sharing those details with us. Quickly shifting focus to Abdul Bashir, who joins me on the broadcast from Telangana. Abdul, Telangana was one of the states that the Prime Minister had put out a scathing remark with regards to the excise duty, with regards to the fuel tax, and obviously the concern that the central government has with regards to the fear of spread of wave 3 in the states.
Yeah, absolutely. If we see that now the fuel prices that are there in Telangana are very high among the other states. And now when it comes to the COVID situation, however, not many number of COVID cases are being reported, but amongst the samples that were tested in the state, that is 15,633 samples that were tested yesterday, 30 of them have tested positive in the Telangana state with no fatality due to COVID in the state. And as far as Andhra Pradesh is concerned, in Andhra Pradesh, amongst the 3,595 samples that were tested, only 4 people have tested positive to COVID-19. And
okay. So far the numbers are in control, but there are precautionary measures that obviously will be taken by the state administration, and therefore a meeting that has been held by the Prime Minister with all the chief ministers of the states, including of Telangana. Let's quickly shift our focus to Gujarat, where Abhijit joins me on the broadcast. Abhijit, the situation in Gujarat under control. It is under control across the country at this point of time. Masking mandates, however, have been brought back.
बिल्कुल, मैं बता दूं जिस तरह से गुजरात में 19 केस पिछले 24 घंटों में दर्ज किए गए और 99 एक्टिव केसेस है। हालांकि जिस तरह से मास्क की जो सिचुएशन है, तो मास्क कंपलसरी है वहां पर, और किसी भी हाल में मास्क निकाल के घूम नहीं सकते, और वहां पर अगर मास्क निकाल के घूमे तो 500 रुपए का फाइन जो है वो तुरंत ही वसूल किया जाता है। और जिस तरह से सोशल डिस्टेंसिंग, और आज प्रधानमंत्री नरेंद्र मोदी ने सभी राज्यों के मुख्यमंत्रियों के साथ जो बैठक करी, उसमें भी प्रधानमंत्री ने यही बताया कि आने वाले दिनों में त्योहार आ रहे हैं, तो उसमें भी संयम रखना है और सभी लोगों को सोशल डिस्टेंसिंग, क्योंकि जिस तरह से देश भर में कोरोना के केसेस बढ़ रहे हैं, तो उसको चलते हमें सावधानी बरतनी है। तो उसको चलते गुजरात में भी काफी सारे प्रिकॉशंस अभी भी जारी कर दिए गए हैं, और जो जिस तरह से स्कूल्स में छोटे बच्चों को भी इन्फेक्शन लगता है, तो उसको चलते भी स्कूल्स को भी अलर्ट मोड पे रखा गया है कि अगर कोई भी बच्चा कोरोना संक्रमित पाया जाता है तो स्कूल को तुरंत ही बंद करने का भी आदेश दिया गया है। जी,
Okay, thank you Abhijit for sharing those details with us. Let's quickly get in my panelists on the broadcast right now. They're all good doctors who are going to shed light into the looming situation that we find ourselves in. Would there be a third, would there be a fourth wave is the big worry everybody has across the country. Dr. G.C. Khilnani, he's the chairperson of the Pulmonary Critical Care PSRI Hospital. It's good to have you on the broadcast with us, Dr. Khilnani. My first question to you with regards to the scare that is being witnessed. There are numbers that are now quickly rising. What should be the action that needs to be taken by the state administrations, district administrations and doctors and people in general?
Thank you very much. This is actually not unexpected given the fact that marriage parties have started, movements have started. You hardly see a mask covering the face and nose in city of Delhi. People have the mask, but it's most of the time around the neck. A lot of celebrations are going on. Travel has started. In my experience, we have admitted several patients in last 2 weeks, but these are all mild cases with severe comorbidities. Those are getting admitted. The patients that we are seeing online of COVID are generally have a very, very mild illness. That's actually a silver lining. And I would like to tell you why it is like this. And every expert feels that 90% of the Indian population already infected. More than 70% of adults are fully vaccinated. Even the school children from 12 to 17 are vaccinated. This is the group of people when they get COVID, they get a mild disease. And it is proven beyond doubt now that vaccination hardly prevents occurrence of infection, only to a small extent, but it is also proven that it prevents severity of disease. And that is what we are watching now, that the cases have risen, the positivity rate is something like 4.5% in city of Delhi. Very few cases are being actually recorded. The reason is that they suffer from mild disease, they don't get themselves tested. If the one person gets tested in family, the rest of the 5-10 people don't even get tested because there is no scare. So the numbers are much more than what are being reported, and my appeal to the masses through your TV channel would be, please don't be complacent.
Okay.
Mask
Don't
is
be
only one thing.
complacent. Be extremely vigilant and take judicious measures when stepping out. Masking mandates are back in several of the states. It should now be made mandatory across the country. Dr. Nitin Agarwal, could I get a response from you, especially with regards to the vaccination drive that is being carried out? And there are vaccine mandates that have now been made applicable for age groups between 6 and 12, as well as those between the groups of 18 to 39.
Yes, as Dr. Khilnani mentioned, that vaccination drive has its own limitations, and it has been proven that it has the limitations that we can slow down the process of proliferation of the virus, probably among the masses, but also the severity of the infections. But as an Ayurveda doctor, my emphasis would be that we should definitely enhance the immunity of our population, of our masses. And that has been very successfully demonstrated also in the last 2 years. There have been ample number of cases, probably millions, where all over the country, proven now also by Ministry of Ayush, as well as Ministry of Health, that people who have been taking Ayurveda herbs, of course, in consultation with their doctors, not in a random way, they have very successfully able to manage the diseases without hospitalization. And that is the key, because hospitalization has their own limitations. There are limited beds. And as we saw in the second wave specifically, where really we got exhausted with that aspect, and it was kind of an emergency all over the country vis-a-vis hospitalization.
Okay.
And in that case, if we are able to enhance the immune system, especially of our children, they can run their classes at a school. They don't have to shut down the schools again. They can still manage, play a normal life, which has been hampered for last 2 years. And I think so, this is the key, that how long we will live with this situation and how many years do we have to spend more inside our homes, inside our controlled environment. So immunity enhancing, taking with Ayurveda herbs, together with all the measures taken by the government, including immunization, should be the way forward.
I also have Dr. Sumit Chakravarti on the broadcast with me from Asian Hospital. Dr. Sumit, the important point that has been mentioned by the Prime Minister is also about the increased cooperation and coordination between the centre and the states. There has been an alert that has been issued by him. He said there needs to be state hospital audits that need to be done in wake of the heat wave. Now, it's not just the COVID likely fourth wave that the country might be having to tackle. It is also the second issue of the heat wave. Now, these are two swords that are hanging on the health administration across the country.
Yeah, very true. Look, COVID definitely this time, fortunately, is a mild illness. I, being a child specialist, fortunately for children, COVID has been a mild illness throughout. Very few kids have required admission, and none of them has actually suffered from death at our institution. So, looking at the overall scenario, COVID is a safe illness for kids, and with the vaccination drive, now we have started for the 5-year and above. So, with the vaccination drive, definitely we'll make sure that kids who have not got infection yet, they will also be protected against the severe COVID illness in case they develop COVID infection. Number one. Number two, heat wave certainly needs to be tackled. 2 साल का बच्चे बाहर निकल रहे हैं, they really want to get out and play in the park. So we have to maintain for the kids, it's parents who have to make sure that their kids remain hydrated. They wear light cotton clothes, they drink a lot of water. They have a lot of fresh fruits and vegetables. Watermelon has a good quantity of water. Kharbuja, fruits and vegetables. So primarily at parents level, we have to educate the parents to take care of their children. They should wear hat. These kind of things are definitely going to help at individual level. If through your channel we can make the parents aware how to prevent your child from heat stroke, I think that will go in the long run.
Absolutely. I thank all my good doctors for joining me on the broadcast and sharing their insight on this issue that is a cause of concern countrywide.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.